The issue is that the soldiers can't get replacement blood quick enough, which means these deaths fall in the, quote, preventable death category. If these soldiers were in a hospital setting, their lives could have been saved because they would have had immediate access to blood. What the medics are armed with in the field right now is freeze-dried plasma. It's in a small little IV bag, and what the medic does is he adds sterile water to basically reconstitute it, and then it's ready for the wounded soldier. This freeze-dried plasma gives wounded soldier the clotting factors they're going to need to stop the bleeding. But what's missing? The oxygen carrying capacity. Now, in our 8K, we mentioned we're in the process of lyophilizing, or what is known as freeze drying, our universal oxygen carrier. So I can envision our product working side by side freeze-dried plasma. Once we prove that we can freeze-dry and reconstitute our universal oxygen carrier, it's probably time to approach the military. I mean, what military wouldn't want something that's shelf-stable for 5 years and turns into a universal oxygen carrier once it's reconstituted? This is almost a no-brainer, but why stop at the military? Why wouldn't civilian EMTs want this? So, did you know that almost no EMTs in ambulances carry blood with them, except the ones in the helicopters? This could be a very powerful tool for them too. The concept is mind-boggling how this could change emergency medicine.